Good afternoon, everyone. Um, I'm Dr. Joey Villarosa, Medical Officer 3 of the Department of Education. I have been the medical officer for the last 10 years of the Department of Education, Division of Negros Occidental. I have been tasked by our superintendent, Ma'am Marcet Sabaloka, to help create school health and safety protocols, which I will be presenting to you this afternoon. So the objectives of the school health and safety protocols is to provide basic information on COVID-19, its symptoms, transmission, prevention methods, and detail the health and sanitation procedures to be followed in schools. Parameters and other preventive actions to be adopted by schools to ensure a healthy and safe working and learning environment. Prepare school heads on possible measures on how to respond to COVID-19 related situations that may arise in offices or schools. Again, I would like to emphasize that we are not yet allowed by the Department of Health, which is the governing body for all health issues in our country, to return to normal. And not until the time that a vaccine will be in place and definitive treatment for the COVID-19 infection is in place, that we can declare an all clear or a safe return to work or school for our personnel or learners. But this manual is intended to give a safe, intended to guide our school heads for a safe return to work if possible. But if given a choice, we should provide alternative means of service delivery to our learners. And this manual should be used as a last recourse. So, what is COVID-19? The official name is Coronavirus Disease 2019. Coronavirus is a family of viruses that causes respiratory infections in human beings. And the coronavirus virus 2019 is a new or novel strain of virus. New or novel means that it was never seen before in humans. What does this imply? We have no natural immunity against this virus, and if we are exposed, we will develop the disease. It causes respiratory illness ranging from mild symptoms to acute respiratory distress syndrome. So what are the symptoms of COVID? According to the literature, fever or a temperature of 37.8 degrees or higher, common in viral infections, body malaise or weakness, fatigue, flu-like symptoms like cough, runny nose, respiratory symptoms, itchiness of throat, shortness of breath, and breathing difficulties. This is according to the guidelines set by the DOH in 2019. Some patients develop pneumonia, and these are labeled as severe cases of COVID-19. Some patients develop acute respiratory distress syndrome, multi-organ failure, in particular kidney failure, which could lead to death. So according to the World Health Organization infographic, how to recognize COVID-19 symptoms, in mild cases, there is cough, fever, and fatigue. In moderate cases, there is mild viral pneumonia and breathing difficulties. In severe cases, severe pneumonia and other organ failure may develop and possibly even death. So how does COVID-19 spread? It is spread primarily through droplet infection, through coughing, sneezing, or talking. So this is an infographic which describes the Wuhan coronavirus or COVID-19 2019 virus. It is a droplet infection wherein the virus is contained within large aerosolized particles greater than 5 microns. It is different from airborne or smaller aerosol particles like viruses that bring measles and other viral strains. If a person infected with COVID coughs, the maximum distance is estimated to be 3 feet, whereas other viral diseases that have airborne capabilities spread to a maximum distance of 6 feet. So how does COVID-19 spread? There are portals of entry for COVID-19 virus to enter the human body. The respiratory droplets containing the virus enter through 3 portals of entry: the mouth, the eyes, and the nose. So when we make our preventive measures, personal protective measures, we protect these 3 vital portals of entry. We cover our mouth with a face mask. We cover our eyes with a face shield, and we cover our nose also with a face mask. Also, we avoid touching our eyes with our hands. That's why hand washing and hand sanitizing is very important. So COVID can also be spread by touching surfaces contaminated by the droplet. The droplet may survive on surfaces for several hours, but as with all viruses, it does not live long outside the body of its host. The virus always needs a host to survive. It does not live long outside. So disinfectants like isopropyl alcohol, Lysol solution, bleach solution, chlorine solution, and hand washing with soap and water for 20 seconds effectively kills the virus. So COVID-19 spreads primarily from person to person. Droplets released when someone sick, sneezes, or coughs can land on the mouths or noses of people nearby. Also, close contact with someone sick, like hugging or shaking hands, should be avoided. COVID-19 mainly spreads from person to person, but it can also be left on objects and surfaces, like elevator lift buttons, doorknobs, digital devices like cell phones, laptops, mouse, and pens. If you touch something contaminated, then touch your face or another person's face, you might get infected or fall ill. Touch. Okay, we have. Okay, who are most at risk for COVID-19? Those at risk are older individuals, 60 years old and above, individuals with chronic medical conditions like diabetes, hypertension, bronchial asthma, heart disease. They are at most risk for developing severe symptoms. How about school-age children? As this is a new virus, medical experts are still learning about how it affects children. Primarily, children are most likely asymptomatic carriers or manifest only mild symptoms. As pediatric clinical practice guidelines will be developed for school-age children, we will be updating this manual. And in short, we must never assume that it is safe. Opening schools and physical contact with learners and personnel must be avoided. And as a recommendation, alternative methods of service delivery must be explored. The measures in this manual are the last recourse. When the government lifts all measures and assure everyone of the safety, this will be applied to all schools in the division of Negros Occidental. So, WHO recommendation, what to do if you feel unwell. The advice differs by country and by locality. So please follow the national health advice or the local advice in your LGUs. If you're under 60 years old and without an underlying medical condition, you are classified as low risk. So you are advised to self-monitor, self-isolate, and stay home until you are well. But if you are over 60 years old and have an underlying health condition, you are classified as high risk. If possible, contact your healthcare provider and follow their advice before going to the nearest healthcare facility. Anyone experiencing difficulty breathing should seek immediate medical attention. What is the treatment for COVID-19? there is no available treatment. There is no approved treatment. As of the moment, there is no vaccine available. Only supportive management for symptoms are being implemented in the hospitals. So what are supportive management? Oxygen delivery through nasal cannula for those with difficulty of breathing. If still experiencing difficulty of breathing, that nasal cannula can be upgraded to a mask, or in very severe cases in which respiratory failure is imminent, intubation is done and the patient is attached to a mechanical ventilator. Also, fluid support, nutritional support, and intravenous fluids are administered. Probably antipyretics or paracetamol for fever, but there is no specific medicine to combat COVID-19. So, in the absence of treatment and in the absence of a vaccine, it is deemed unsafe to expose yourself outside. So the best thing that we can do is to prevent the spread of COVID-19. How can COVID-19 be slowed down or prevented? It could be prevented by staying at home. Staying at home, particularly if you are not feeling well. You go out only when absolutely necessary, and the use of face mask when in public at all times. Practice cough etiquette, and again, for emphasis, use of face mask in public. Limiting social gatherings and crowd-drawing activities like shows, graduations, and seminars. Washing hands often with soap and water for 20 seconds or the use of hand sanitizers. Cleaning of frequently touched surfaces and objects like doorknobs, door handles, and gadgets, mouse, laptops, everything that is frequently touched. So to reduce your risk of COVID-19, you have to clean your hands often. Practice cough etiquette by coughing or sneezing in your bent elbow and not your hands. Avoid touching your eyes, nose, and mouth. Limit social gatherings and time spent in crowded places. Avoid close contact with someone who is sick. Clean and disinfect frequently touched objects and surfaces. Division COVID-19 Task Force or Response Team. The division office, district offices, and schools are advised to create a task force or a response team for the COVID-19. For the division, district, and school, task force lead. For the division office, the medical officer 3 is the lead in the division, the PSDS in the district, and the school head in the schools. The task is to oversee the implementation of the overall schools division health services program, preparedness, and prepare a response plan. We also provide written guidance and algorithms for school nurses, clinic teachers, and other school personnel regarding health emergencies, illnesses, or injury. We have also the virus prevention and protocols lead. This is composed of nurses and or school clinic teachers in schools. The main task is to develop protocols to ensure the wellness of all employees and the overall pandemic preparedness and response plan, and ensures the alignment with the national and regional COVID-19 task force. The VPPL promotes daily preventive actions for all school personnel, learners, parents, and visitors, and advocates mental health mitigation by sharing strategies for personnel and learners, effective in reducing anxiety and reinforcing their coping skills. So this pandemic, this crisis that we are facing right now, induces a lot of anxiety to individuals. So mental health is of paramount importance. We should help each other overcome all the issues and problems that the pandemic brings about, and we will try to help each other by being there for one another and to assure the mental health of everyone. Also, the VPPL initiates and maintains surveillance. There are two kinds of surveillance. We have the active and the passive surveillance. The active surveillance is that the school clinic teacher or the nurses, they are the ones going into the classrooms and checking if there are sick school children. But we also could employ a passive method of surveillance wherein we wait for a student or a visitor or a personnel that does not feel well and wait for them to approach the health personnel and give information why he or she is unwell. So in short, we do not actively go out but wait for the patient to have a consult. That is the passive surveillance. Also, a vital lead is the security lead. It is composed of the security guard and one supervising personnel. The task of the security lead is very important because they are the first line of defense in the layer of protection of the school or the division office or the district office. So whenever a visitor or a learner goes into the entrance of the school, thermal scanning at the entrance should be done. It is of paramount importance that we train our security personnel how to operate the thermal scanner and how to identify symptomatic patients. So they are very important because they provide the first layer of protection for the school. The security lead should enforce the no mask, no entry policy. We have a provincial memorandum for that all the general public must wear face masks when in public. And another vital task of the security lead is to ensure the social distancing measures are stringently observed by learners, school personnel, and visitors upon arrival and departure from the school premises. So social distancing, we have to maintain a distance of 2 meters away from another person. The security lead also offers support to the VPPL leader by providing site-specific options regarding social distancing within the area and potential mitigation measures to manage the risk of all individuals which cannot adhere to the more than 1 meter social distancing. So it should be emphasized that discipline should be enforced and the imposition of that discipline should be led by the security officers. Sanitation and disinfection lead. This is spearheaded by the school's WINS coordinator. The Department of Education already has school-based management, water, sanitation, and hygiene in schools, and we should implement it strictly this coming school year. The sanitation and disinfection lead works to manage daily and periodic disinfection logistics. So routine and deep cleaning disinfection processes following the protocol set by the VPPL leader drives the continual improvement process and ensures 100% compliance of the disinfection protocol. This is composed of the DRRM coordinator and school heads. The task of the communication and warning lead is to manage all pandemic COVID-19 related communications. Ensure the timely and accurate information gets to key stakeholders like the school personnel, learners, families, and community, and comply with the Data Privacy Act. The CWL also provides guidance that empowers school personnel and families to help cope emotionally with the crisis. So they work in conjunction with the mental health coordinator. Also, the DRRM manages training related to pandemic preparedness and response. They are responsible for COVID-19 response team trainings. They observe proper referral system protocol to other government agencies, particularly the Department of Health. So PPE and materials lead. It is composed of the district or school property custodian. Their task is to secure adequacy of all necessary supplies. develops plan for stockpiling and distribution of PPE supplies and sanitation materials, such as face shields, face masks, sodium hypochlorite solution, and cleaning equipments. So this is the organizational chart of the Division COVID-19 Task Force. So there is the Division, District, or School COVID-19 Task Force Lead, the Security Lead, composed of the Security Guard and one supervising personnel, the VPPL, Virus Prevention and Protocols Lead, nurses and clinic teachers, mental health coordinator in schools, the Sanitation and Disinfection Lead, SBM WINS, and the WINS Coordinator, the Communication and Warning Lead, composed of the DRRM Coordinator, the PPE and Materials Lead, composed of the Property Custodian. So for school protocols, we have 19 sections in the school protocols. The first is on-site temperature and health screening in schools. Maintaining a healthy, sanitary, and safe school learning environment. Protecting the most vulnerable school personnel. Protecting the learners. Procedures in sending sick learners, teaching and non-teaching personnel home. Recess and lunch break. Transfer of learners and school personnel. Social physical distancing protocols. Holding area in schools for parents of kinder and grade 1 learners. Cleaning and disinfection protocol. Deep cleaning and disinfection protocol. Maintaining personal hygiene. What to do if a learner, school personnel becomes unwell and believes he or she has been exposed to COVID-19. What to do if an individual and suspected COVID-19 patient has recently been in your school. What to do when individuals in the school have contact with a confirmed case of COVID-19. Protocols for learners, school personnel to return to school following COVID-19 exposure or infection. Dental procedure protocol, school-level training, conferences, seminars, and workshop protocol, monitoring and evaluation protocol, facility signage, and infographics. On-site temperature and health screening in schools. On-site screening shall be performed at the entrance of the school. Temperature monitoring or scanning should be done. It will be conducted for all individuals, no exemptions. So learners, school personnel, stakeholders, and visitors must be scanned for their body temperature before entering the school. Make sure to follow and maintain distance of 1 meter per person upon entering the school. Markers are highly recommended to ensure that the desired distance is being complied for. So this is what we did at the division office. We measured and placed circles in the ground and have it painted with traffic paint, fluorescent paint. So these are the markings on the ground. They have a distance of 2 meters. Also a dedicated footwalk where the clients at the division office will line up. So what to do on the on-site temperature and health screening in schools? Check the temperature and face mask at the gate. Strictly no face mask, no entry policy. And a temperature of 37.8 degrees Celsius or greater, there is absolutely no entry. It must be stringently observed by all learners, school personnel, and visitors. Face masks must be worn at all times and removed only when eating and drinking. So this is the temperature monitoring here at the division office, observing proper social distancing measures. Also, forms for symptomatic or febrile learners, school personnel, and visitors or stakeholders must be filled up if they are found to be symptomatic or they are found to be febrile. All learners and visitors with symptoms it must be emphasized that they will not be allowed inside the school premises. And all visitors, particularly non-DepEd personnel, with no prior notification of arrival or appointment, will not be allowed inside the school premises. So it is important that we tell our visitors and stakeholders that they should inform in advance that they are going to visit the school. Okay, this is an infographic summarizing all the salient points of the on-site temperature monitoring. Maintaining a healthy, sanitary, and safe school environment. Face masks must be worn at all times. We must provide accessible hand washing facility with a regular supply of soap, of water and soap or hand sanitizer that contains at least 70% alcohol solution. All rooms in the school are to be 100% disinfected before school personnel and learners return to school. The use of biometric equipment should be discouraged because it could be touched by the infection could be spread through the fingers of our hand. Bandy cloth should be used instead. And if possible, there should be a pedal-controlled hand washing facility outside at school entrance. And foot baths or rag soaked in sodium hypochlorite bleach solution should be present at the school gate. This is an example of what a foot bath and a foot-operated hand washing equipment. Sanitizers shall be made available. Equipment or vehicles entering the premises must go through a disinfection process. For communal bathrooms or comfort rooms with individual cubicles, only a maximum of 2 persons are allowed inside. So protecting our most vulnerable school personnel. Again, it is imperative that we identify individuals who are high risk through medical history form and Form 86, which are in the custody of the schools. So those patients who are 60 years old and above, those who are pregnant or suspected to be pregnant, have cancer, hypertension, respiratory problems, diabetes, and conditions that compromise the immune system. They should have flexible or alternative work arrangement, especially for the pregnant and the high-risk individuals. Protecting our learners. So we have to add facilities in our school. We have to add a waiting area at the guardhouse for parents of kinder and grade 1 learners. We add a waiting area for learners who develop symptoms despite the screening at the entrance. So these are the learners or personnel that pass the temperature scanning. But during the course of the day, they develop fever and they become unwell. So they must be brought to a waiting area. And we should add isolation areas at clinics for febrile students. So prior to the start of the school year, we must issue checklist for parents. So this checklist is composed of a series of questions on the health condition of the child. So we have a child with a special need or SPED students, those with chronic upper respiratory problems, primary complex or PV, skin rashes or allergies, heart problem, above normal body temperature, mild cough, sick diarrhea or rhinitis. If the parent of the child checks yes to any of the conditions, we must set a precedent that this child must be assessed further by the rural health physician for their health status prior to allowing them to report to school. So learners who have shown signs and symptoms inside the school campus or classroom will be isolated. Provide adequate group hand washing facilities. Encourage learners to wash their hands with soap and water for at least 20 seconds. And the use of hand sanitizers. Maintain social distancing at all times. Foot bath, wet rag soaked in chlorine or sodium hypochlorite solution should be made available at school entrance and outside the classrooms. Require learners to use foot socks inside the classroom and leave footwear outside the classroom. Teachers' move policy should be observed during face-to-face and regular classes. Movement of learners should be strictly prohibited. So the procedure in sending sick learners, teaching and non-teaching personnel home. If learners, school personnel get sick in the school, they should first be brought to an isolation area. And parents of these learners must be notified to pick them up. The teacher should accompany the learner, especially in the elementary level, to the waiting area near the guardhouse and instruct the guard to secure the learner is safe while waiting for transportation or the parent. So the waiting area should have social distancing markings, and the teacher and the guard must have adequate personal protective equipment. At the bare minimum, they should be issued a face shield and a face mask. Recess and lunch breaks. Apply schedule rotation, alternate reporting by identifying the essential employees and making sure that each section will not run out of staff. Encourage all teachers and non-teaching personnel to bring packed meals to avoid going in and out of the school, office, classroom. Alternative schedule for recess and apply social distancing at school canteens. There should be a plastic screen at counters and the cashier. Observe 1 meter distance from each other inside the canteen. And markers are highly recommended to be placed outside and preferably also in the inside of the canteen to ensure physical distancing. Transfer of learners and school personnel. So transfer means transfer from one school to another. If the transfer occurs within the province of Negros Occidental, the learner or the personnel shall be required to present a certification issued by the local health unit declaring that the transferee has not manifested COVID-19 like symptoms for the past 14 days before the date of transfer. So for other transfers, we need to require a negative COVID-19 test result or the RT-PCR test result. The RT-PCR, the RT does not stand for rapid test, but rather it is an acronym for the very long and detailed procedure to confirm the presence or absence of COVID-19. The RT is called reverse transcriptase, and the PCR is polymerase chain reaction. So we have to obtain an RT-PCR result if the transferee is from other provinces in the region. Like for example, we are in the division of Negros Occidental and the transferee is from the province of Iloilo. Also, transfers of learners, school personnel from other regions within the country, we should require an RT-PCR result. Failure to present an RT-PCR result, there should be no contact. There should be a no contact policy for that learner and personnel. That learner shall be given modules or engaged in other alternatives of learning until cleared. So if that student will not be denied enrollment, she will be enrolled, but she would not be allowed to report to school physically until they could present a negative RT-PCR result. Social and physical distancing protocols. Social distancing is deliberately increasing the physical space and minimizing the physical contact between people to avoid spreading the illness. So the minimum distance should be 6 feet or 2 meters. Some portions of the slide mentioned 1 meter. So, but basically we have to maintain at least a space of 1 meter between two persons. Limiting large groups of people coming together, like seminars, meetings, closing the buildings, and canceling big events. Eliminating contact with coworkers, such as handshakes, embracing coworkers, visitors, and friends. Avoiding touching surfaces touched by others to the extent feasible. Avoid anyone who appears to be sick or who is coughing or sneezing. So these are examples of classroom structure. We have the Marcos prefabricated structure, 7 by 6 meters. The maximum learners should be 20 learners in this type of classroom. For the RPUS Bayanihan type, 8 by 6 meters, a maximum of 24 learners are allowed. For the BLSB type 1, 2, and 3, 6 by 8 meters, a maximum of 20 learners are allowed. For the deck standard design 7 by 8 meters, 25 learners are allowed. DepEd standard design 7 by 9 meters, a maximum of 30 learners are allowed. So for stairs, we should have 2 sets. 1 stair for going up and 1 stair for going down. Holding area in schools for parents of kinder and grade 1 learners. A holding area near the entrance for parents who are waiting for their children. In this holding area, all parents should be subjected to temperature scanning, social distancing, use of face mask, signages must be put up, and a foot bath and hand washing facility must be in place at the holding area. Cleaning and disinfection protocols. Disinfect all areas of the school. If there are rooms with air conditioners, we should also disinfect and clean the aircon filters. Workstations and equipment, laboratories, canteens, restrooms, lockers, drawers, cabinets, common surface areas, computer screens, and keyboards must be disinfected regularly. So this table emphasizes the common areas or places, the disinfection content, what are the objects in these areas, what is the recommended disinfectant. Our recommended disinfectant is sodium hypochlorite solution. So disinfection measures, spraying or wiping, and the frequency of the disinfection. For commonly touched surfaces, it should be at least 4 times a day. For walls and floors, periodic cleaning only is needed. One emphasis is for transportation vehicles. If there are schools with vehicles, it should be sprayed with disinfectant solution before and after each use. So our preferred disinfection solution is sodium hypochlorite or Zonrox. So the concentration should be 9 glasses of clean water plus 1 glass of sodium hypochlorite. Or if chlorine powder is going to be used, 1 tablespoon of chlorine powder for every 2 liters of water. How to clean and disinfect the office to help slow the spread of the COVID-19. First, we should know the difference between cleaning, disinfecting, and sanitizing. Cleaning removes dirt, germs, and impurities from surfaces or objects. Disinfecting kills germs on surfaces or objects. Disinfecting works by using chemicals to kill germs on surfaces or objects. So sanitizing is different from disinfecting because sanitizing lowers the number of germs on surfaces or objects to a safe level as judged by public health standards or requirements. Usually, sanitation is being done in high-risk areas like the hospitals, emergency rooms, operating rooms or ICUs or isolation rooms in hospitals. So sanitizing should be done by professionals, and DepEd is only required at the level of disinfection. So to clean and disinfect surfaces and objects that are touched often, we do routine cleaning and disinfecting. Clean and disinfect correctly. We should not be in a hurry. Use products safely by reading the labels on the chemicals for safe use. Handle waste properly. Discard rather than clean or disinfect highly contaminated items. So if something that we use cannot be cleaned adequately or cannot be disinfected adequately, it should be discarded. Wash hands frequently, including after emptying waste baskets and touching tissues and similar waste products. So supplies needed during disinfection. The bare minimum should be waterproof gloves, such as latex, nitrile, or dishwashing gloves. Liquid and soap, detergent, warm water, clean towels, and leak-proof plastic trash bags should be adequate. Disposable gowns for extensive cleaning-related tasks, including taking out industrial trash. Face mask, goggles, they're optional to prevent infections to cleaning and disinfecting solvents and disinfectants like isopropyl alcohol, Lysol, or sodium hypochlorite solution. So for deep cleaning and disinfection, it should be done only through an approved external agency. It should not be attempted by DepEd personnel. If a school has a suspected COVID case, we should not do our own local disinfection, but instead request for assistance from the DOH or other similar government agencies to do the sanitation procedure. Because sanitation requires trained personnel to execute the process of cleaning, disinfection, and disposal of hazardous waste. They should also have proper equipment. So all necessary procedures and local authorizations or permits to perform disinfection services and manage any wastes must be generated by this approved external agency. The only task of DepEd is the Division COVID-19 Task Force must coordinate and supervise the cleaning and disinfection process. So, maintaining personal hygiene. Practice regular and thorough hand washing every 4 hours using soap and water for at least 20 seconds or with an alcohol-based sanitizer which contains at least 70% alcohol. So the steps in hand washing, these are detailed by our SBM WINS procedures. So what is emphasized here, that the hand washing should last for at least 20 seconds. Wearing of face mask, practicing of cough etiquette by covering our mouth and nose when coughing using the crook of our elbow. Avoid touching eyes, nose, mouth, or face with an unwashed hand. Ensure hand hygiene supplies are readily available in prominent places around the school premises, and if using a dispenser, make sure these are regularly refilled. Ensure that face masks and tissues are available at the workplace for those who develop a runny nose or a cough at work. Pedal controlled closed bins for hygienically disposing of tissues. Display posters promoting respiratory hygiene and limitation of physical contact. So, what to do if a learner or personnel becomes unwell and believes that he or she has been exposed to COVID-19? Okay. So when a learner or personnel approaches a teacher and says that they are having symptoms that might be related to COVID, the school clinic teacher handling the patient must take all the necessary precautions to avoid being infected. They should have at least a face mask and a face shield. Send the learner to the isolation area. assess the condition of the unwell child or personnel using the COVID-19 case form. The teacher advisor must inform the parent or guardian of the learner's health condition. If necessary, give first aid to mild to moderate symptoms. Send learners home with going home instruction. The learner's condition must be monitored by the advisor every day for at least 14 days. For severe cases, we should ask the help of the nearest DOH healthcare facility. What to do if an individual with suspected COVID has recently been in your school? So this might be a rare case, but it could very well be possible. The Division COVID-19 Task Force must be contacted immediately by the designated school teacher. An incident report must be generated and a case discussion with the medical officer must be made, and advice on any actions or precautions that should be taken. The Division 19 Task Force lead will provide technical assistance on how to manage staff and members of the public based on the assessment of the risk. The designated clinic teacher will do contact tracing with the affected person directly to advise on isolation and identify other contacts to whom they will give appropriate advice. Again, we will give advice, but we will leave the contact tracing primarily to the Department of Health. If a learner or school personnel is confirmed to have COVID-19, the school head should inform other learners and school personnel of their possible exposure to COVID-19 in the workplace, but must have data privacy to maintain confidentiality. Learners and school personnel exposed to fellow learners and personnel with confirmed COVID-19 should be given instructions what to do according to the agency's policies and guidelines based on the interagency task force guidance. So what we have now is if there is a suspected contact with a positive COVID-19 case, all close contacts must isolate for a period of 14 days. Inform and coordinate with the nearest DOH facility. Learners and school personnel who are well but who have a sick family member at home with a COVID-19 should also notify their school head and refer to the school COVID-19 task force guidance as to how to assess their potential exposure and measures that they should undertake. But the rule of the thumb is if there's an exposure, any exposure to COVID-19, automatic 14-day quarantine must be imposed. So what to do when individuals in the school have a contact with a confirmed case of COVID-19? If a confirmed case is identified in the school, the designated clinic teacher will advise 14-day quarantine to any individual that has been in close face-to-face or physical contact. Anyone who has spent any length of time with the worker while he or she was asymptomatic. Anyone who has cleaned up bodily fluids. Close friendships or work groups. Any individual living in the same household as with a confirmed case. Those who have close contact will be asked to self-isolate and stay at home for 14 days from the last time they had contact with a confirmed case. If they develop new symptoms or their existing symptoms worsen within the 14-day observation period, they should call the designated public health services for reassessment. That is the time to contact the DOH. If within the 14-day period they develop fever, cough, they should contact the DOH. If they're unwell at any time within their 14-day observation period and they test positive for COVID-19, they will become a confirmed case and will be treated for the COVID-19 disease. If testing is not available, but the symptoms are consistent with COVID-19, they may be considered as a confirmed case. This is to show that we must have a high index of suspicion in order to maintain the safety of everyone, and they must not be allowed inside the school premises. Learners and school personnel who have not had close contact with the original confirmed case, so those who had no contact, need not take any precautions other than monitoring the health symptoms and can continue to attend school. So this is a gray area. If you have not had any close contact, it is safe to say that you can go to school. But for the side of safety, if there's a confirmed case in the school, it would be prudent that all personnel should have 14-day quarantine, because we could never be sure if we are infected or not. So a confirmed case of COVID-19 in schools will cause anxiety among coworkers, and some may feel stressed. So clear communication is important, directing learners and school personnel to reliable sources of information about COVID-19. As in the case of DepEd, the school health and nutrition personnel should be contacted immediately. And school principals or heads should be supportive and should be supportive and understanding, and as far as possible, offer flexible work arrangements for these personnel who may be experiencing anxiety. Okay. Protocols for learners and school personnel to return to school following COVID-19 exposure or infection. So learners who have been exposed to a confirmed case of COVID-19 may be permitted to report to the school in the required workplace learning environment setting if all of the following conditions are met. The learners or school personnel are asymptomatic after a 14-day quarantine. While at quarantine, working from home, homeschooling, online, and distance learning resources would not be feasible for job duties and learning. Learners and school personnel undergo self-temperature monitoring. Learners and school personnel are required to wear a face mask at all times. So school personnel whose job duties permit separation of greater than 6 feet should also wear a face mask at all times. We should never be complacent. We should always exercise precautionary measures even if the distances are adequate. If a personnel develops symptoms consistent with COVID-19, such as fever, cough, shortness of breath, while working inside the premises of the school, they should immediately stop work and isolate at home. Testing will be advised for any personnel with symptoms. Essential school personnel with confirmed or suspected COVID-19 can be permitted to work in the required workplace setting if all of the following conditions are met. So if you are confirmed or suspected to have COVID, you have to be isolated for at least 14 days after illness and have not had a fever for at least 72 hours after the 14 days. So 14 days plus 3 days that you are febrile, you will be on isolation for 17 days. So the conditionalities about the 72 hours, you should not have intake of paracetamol or antipyretic medications. Working from home would adversely impact essential services or functions. So even if you are a suspected case of COVID, but your job is very much essential to the functioning of the office or the school, you may be allowed to work, but only under very strict conditions, that all your outputs from your home will be strictly sanitized. And after your 14-day quarantine, a medical certificate must be presented upon return to the workplace. You will not be allowed inside the school premises if you do not present a medical certificate. Note, because these are very unusual circumstances. Again, the emphasis here is that the first layer of protection would be adequate. If the guard or the personnel at the entrance can monitor and scan the temperature and identify febrile patients and prevent them from entering the school premises, that protection is already adequate. So, in the unusual circumstances that they may be unlikely encountered in normal setting, the school will be strict, but not too strict to hamper operations. So we really have to identify whether the personnel or the learner is really sick. We have to train our security guards and school clinic teachers to identify symptoms. The final discretion as to whether to allow the returning learner or personnel to enter the school or not will depend primarily on the school head, upon the advice of the health personnel, nurse 2, the medical officer, and the school clinic teacher who are manning the health screening and monitoring post at the school entrance also has the discretion on learners and personnel that are febrile or symptomatic to deny outright entry. So at the entrance, we can already prevent the entry of these learners and personnel. But in the unlikely event that they will be allowed to enter and they manifest symptoms consistent with COVID, automatically the school must be sanitized and all contacts must undergo a 14-day quarantine. So it would really hamper operations. So from the start, from the gate, we should already be alert and prevent entry of these symptomatic individuals. Okay, so furthermore, the school-led school clinic teacher is advised that when in doubt of their circumstances, they may deny entry of such individuals for the ultimate safety of the general population of the school. And all decisions must be noted in the logbook. If there are any complaints, the division office, particularly the school health and nutrition section, will support whatever decision of the school head regarding the denial of entry. Okay. For dental procedures are the CDC or Centers for Disease Control recommends that dental facilities postpone elective procedures, surgeries, and non-urgent dental visits, and prioritize urgent and emergency visits and procedures until further notice. Our dentists are at the maximum risk because of the oral procedures that they do. In the absence of personal protective equipment, okay. For school-level training, conference, and seminars protocol, so pre-return to school training or the conduct of the NSET training, certain conditions must be implemented, like limitation of physical face-to-face contact. All personnel involved in the training must exhibit no symptoms and should be febrile. No temperature above 37.8 degrees. If possible, limit groups to maximum of 10 personnel only. And the conduct of the seminar, we should practice social distancing. And if possible, use alternative methods of training, such as online meetings as much as possible. So before the training conference or seminar workshop, the area to be used is supposedly to be sanitized. There should be adequacy of supplies. Temperature scanning must be done. Elevated temperature, no entry to the seminar. No face mask, no entry. And if possible, advocate the use of face shields among all participants. So during the training conference or seminar or workshop, we should maintain social distancing, practice cough etiquette, no unnecessary talk, no delays in the conduct of training. and as much as possible, open windows and doors to allow adequate ventilation. After the training conference or seminar workshop, sanitize the area and all equipment used. Retain the names of participants. So there should be a list of participants. If any participant becomes symptomatic or develop COVID-19, all seminar participants will be notified and contact tracing procedures should be implemented. Monitoring and evaluation. The PSDSS and SGOD personnel, including the School Health and Nutrition Unit personnel, will conduct regular monitoring and evaluation of the implementation of the school safety protocols. So this last section is for infographics of the school. These are signages that are recommended to be printed by your school and posted in prominent areas. Again, we should aim for uniformity. If you're from the division of Negros Occidental, there should be one design only. It is possible that we can add the logo of the school, but we must refrain from any deviations in the signages so that we would know that these signages really come from the division of Negros Occidental. So these are basic signages, basic information regarding COVID, basic health practices that has been discussed in the bulk of the PowerPoint presentation that I gave you. So this particular infographic, observing social distancing. So no gathering, no handshake, avoid meeting meals in large groups. So this is another infographic for washing your hands, at least 20 seconds. And supportive management for viral infections, increased oral fluid intake, recommendation 8 to 10 glasses of water every 24 hours, ingestion of hot spicy soup to relieve nasal congestion and promote expectoration of mucus. And another recommendation is a traditional health practice of Filipinos called tuob, or steam inhalation therapy, or water vapor therapy, in which a bowl of very hot water or near boiling water is placed on the floor. You add a counter irritant like menthol or a Vicks solution, and then you allow the steam to go inside while covering yourself with a blanket. So it is expected to change the consistency of the phlegm or the nasal fluids to be able for you to be able to expectorate them or remove them from your nasal cavity. Okay, so that's it. Thank you very much for your time. I hope that the past presentation will be of great help for the schools. I'm grateful for the opportunity from Ma'am Marcet Sabaluca for assigning me this task, and for Ma'am Reboni Imbultorio for all her help in the editing of the manuscript. With that, again, I am Dr. Joey Villarosa, Medical Officer 3 of the Department of Education, Division of Negros Occidental. Thank you very much and good afternoon.